Well, the ultimate goal of a new statewide campaign is to save lives by making sure Hoosiers are equipped to reverse an opioid overdose. The state recently announced an initiative to place at least 2 NaloxBoxes in every county of the state. Business of Health reporter Kylie Valletta has more. Kylie.
Well, thank you, Gary. State leaders say the pandemic has only exacerbated the opioid crisis in Indiana. Overdoses in the state increased 50% in 2020, and the use of naloxone by emergency medical responders has seen a 67% increase. This year is even more concerning. Overdose events in the emergency department have climbed 30% compared to the same time last year. Joining me now to tell us more about this new statewide campaign is Douglas Huntsinger, Indiana's Executive Director for Drug Prevention, Treatment, and Enforcement. Thanks for being on the show today, Doug.
Thanks for having me.
Let's start first with what exactly is a NaloxBox. Can you give us just a little more detail about it?
Yeah, so a NaloxBox is a plastic weatherproof box that holds 6 or 7 doses of naloxone, and they're usually placed in a place that's accessible 24 hours a day. Usually, they're roughly about the size of an AED.
Okay, and what exactly is inside them? About the doses of naloxone?
Yeah, 6 or 7 doses of naloxone and these boxes are available for the public to then access that naloxone, which for your viewers, naloxone is the life-saving opioid reversal drug. When someone is overdosing from an opioid overdose, naloxone reverses that and wakes the person up out of respiratory distress.
And I thought it was interesting. This is somewhat about distribution, kind of reducing barriers. I thought it was more of an emergency situation, but it's not necessarily true, right?
Right. So we have placed some boxes in areas where overdoses are known to have multiple overdoses are known to have happened. But this is also really about how do we distribute naloxone deeper and further into our communities. Our departments of health and our partners at Overdose Lifeline last year distributed 55,000 doses of naloxone statewide. And this allows us to have that available in a way where individuals don't have to interact with someone. So there's not any stigma associated with going and retrieving that naloxone from a NaloxBox.
Right. It's interesting you mentioned the local health departments. They typically, in normal times, have been a big distributor of naloxone, but of course, those local health departments have been overwhelmed with COVID efforts. So explain how this statewide campaign sort of helps fill that gap now.
Yeah, so during COVID, when we began to see an increase in our overdoses and also an increase in naloxone being administered by EMS, one of the things that we did was we added an additional 25,000 doses of naloxone through our partnership with Overdose Lifeline to ensure that anyone who wanted it could access this life-saving medication. And this is really an effort to help and supplement the work that our local health departments have been doing. We know many of them were stretched thin during COVID with COVID-related activities and still are producing vaccination clinics and testing still. So this is really an effort in which we're not just trying to save lives, but also help our locals in ways in which we can ensure that anyone who wants this medication can access it.
Yeah, local health departments certainly have a lot on their plate right now. So the main goal is at least 2 boxes in every county. Can you give us an estimate of how it's going so far?
Yeah, so we've already placed 26 boxes. They're in churches, libraries, treatment centers. There's one on an outside wall of the bar. We have a library in Vincennes that's already had 32 doses retrieved from it. There's a box at a fire station in Sellersburg that has also already had a number of doses. And so this is really just an easy way for a community to help keep people alive during this, this tough time where, already this year we've seen a 30% increase in overdoses over last year.
So what is the call to action? What is the message you really want to get out to Hoosiers about this effort?
So one, if you or a loved one are suffering from substance use disorder, please find a NaloxBox, find naloxone, have it on hand. 211 is a resource that's available if you're looking for a treatment center or one of our statewide recovery hubs. And remember that, addiction is a disease and treatment is available, and most importantly, recovery is possible.
Yeah, you mentioned off camera that one thing you have to remember is, of course, trying to get rid of the stigma, but that addiction is a chronic, relapsing disease. So it's good that people have access to something that can set people on the road to recovery. That's the next step, right?
That's right. Recovery is really hard. And so what's really important is that we keep people alive and that we do everything we can to move them into treatment. And I read a study once that it can take 38 different tries before someone even accepts an offer of help. Well, at that point, they could have burned all their bridges with their family. They could have lost their job. And so we have to ensure that as a state, we're there when someone says, I need help, to provide them with treatment.
Okay, in just a few seconds left, we were showing your map of where your boxes are. Are there any areas that you're really working to penetrate right now, or what's the focus right now as far as the map?
Well, so any area where we don't have already, our local health departments may not be distributing naloxone, or there may not be another distributor in that area, are areas we're focusing, and a specific areas where we know that we have underserved populations in those specific places.
All right, very good. Doug, thanks for being on the show today and telling us about this. Good luck with the rest of the campaign.
Thanks for having me.